Greetings from the Rotary Club in Ciudad Sandino in Nicaragua. We live and work in one of Nicaragua's poorest areas with 180,000 residents located just outside the capital of Managua. I'm delighted to be with you here from the Rotary Club in Ciudad Sandino, but let me introduce myself. Originally from the U.S., those of us here, our families have been living and working in Nicaragua for more than 20 years. Normally, Becca would be with me on these Rotary Zoom calls, but she lives 30 minutes up the road and isn't feeling well, and 6:30 was just a little too early this morning, so I'm going to hold the fort without her. But we have both been here for more than 20 years, and our day job is with the Center for Development in Central America, a project of the U.S.-based nonprofit, the Jubilee House Community, founded over 40 years ago in North Carolina to serve the poor and working in sustainable community development in Nicaragua for 27 years. One aspect of our work has been to help form a Rotary Club here 8 years ago with the idea of opening opportunities for the communities with whom we work, connecting them to Rotarians from around the world. We are a small club, just 12 members, but we work really hard. So how do we serve our community? The big news of 2020 worldwide, of course, was the COVID-19 pandemic. And that was true in Nicaragua too, until we were hit by 2 hurricanes within 2 weeks in November. Hurricane Eta hit as a Category 4 on November 3rd, and Hurricane Iota made landfall as a Category 5 on November 16th in the same spot. Thanks to the preparation and quick action of Nicaraguan authorities, 100,000 people were evacuated from vulnerable areas ahead of the storms, resulting in only 27 deaths between the 2 storms, mostly due to landslides in areas where people refused evacuation. Tragically, further north in Honduras and Guatemala, Eta claimed hundreds of victims. Although we are grateful people here in Nicaragua are safe, the damage done by these storms is a huge blow to our small, impoverished country, with nearly $743 million in damages, 3 million people affected with thousands of homes as well as public health clinics and schools damaged or destroyed. Nicaragua was already the 4th country in the world most affected by climate change, and these storms, now coming more frequently and hitting harder, are a direct result of climate change. In November, Nicaragua, a nation with low carbon emissions, demanded climate justice at a meeting of the Organization of American States, calling for reparations from developed countries with high carbon emissions to offset the cost of these increasing storms which are disproportionately affecting underdeveloped countries. Nicaragua is an agricultural country, growing most of its own food, but most farming is done by smallhold farmers with no access to irrigation, dependent on the weather. With hurricanes, food and cash crops around the country were damaged, so our Rotary Club stepped up to help. First, our Rotary Club collected and sent donations of hygiene supplies and clothing to the most affected communities on the Caribbean coast, partnering with the Moravian Church of Ciudad Sandino. Next, we asked for international partner clubs to send support for replanting beans, and you all were fantastic. You were just unbelievable. If some of you don't know this, you all stepped up to do exactly this. Many regions of the country still have enough residual moisture in the ground after the hurricanes to plant and harvest one more really quick crop of staple food like beans. So our goal, as you know, was to raise $4,500 for 100 affected families to replant beans. Not only because of you did we meet that goal, but we surpassed it, raising $10,020, and were able to send it to 190 families, almost double what we had aimed for. We help them plant beans and also support the replanting of plantains, yucca, fruit trees, tomatoes, and bell peppers. This support went to two of the most affected areas, the mosquito communities in the North Caribbean and San Lorenzo, a rural community in the center of the country. 190 families have received the bean seed and have agreed to put a portion of their crop's yield into a seed bank for next season. The additional plantains and tomatoes will increase food security and improve nutrition. Our day job at the CDCA also responded to the hurricanes, thanks to generous donors and supporters. We've sent several truckloads of used clothing, hygiene kits, blankets, and food to the Caribbean coast as recovery is ongoing. Of course, aiding is complicated by the fact that we're still in the midst of a global COVID-19 pandemic, with no idea when Nicaragua might get access to a vaccine. However, Nicaragua has never gone into lockdown, our hospitals have not been overrun, and the outbreak here remains under control. In fact, as you can see in these World Health Organization graphs, Nicaragua has had fewer cases and deaths related to COVID-19 than any other country in the region. So how has Nicaragua's handling of the pandemic differed from, for example, the U.S. response? First, Nicaragua's free universal healthcare system began preparing for COVID last January, equipping hospitals, labs, and training thousands of medical workers. From late March to mid-May, when cases peaked, lay health promoters carried out 4.5 million home visits in a country of just over 6 million, sharing information, symptom checklists, and identifying possible cases. Nicaraguan health authorities isolate anyone testing positive for COVID-19, although testing is limited, and a negative COVID-19 test is now required for entering travelers, followed up with contact tracing. But in Nicaragua, where crowded living conditions make social distancing impossible, and 60% of the urban population must go to work day to day so that their families can eat, how do you control a pandemic? By learning to live with it safely. Thanks to emergency support from the Rotary clubs of Santa Barbara Sunrise and Point West Sacramento, our small club has been able to play a role in making life safer for our community. First, our club provided healthcare workers in public health centers, in public health clinics in Ciudad Sandino with hygiene supplies and PPE. Next, we focused on families, and our club donated emergency hygiene and cleaning supplies to 17 essential centers serving low-income families. Third, we focused on high-traffic public areas, such as markets, parks, churches, and schools, installing 30 simple hand-washing stations. And now we're working to help our community move from pandemic to progress. And we'd like to have you continue to join us. But what experience does our little club in Ciudad Sandino have? Let us show you just a few projects we've completed in the past 8 years so you can get to know us. In Peace, our club has sponsored Alternatives to Violence workshops, which have trained our Rotary Community Corps on how to respond to potentially violent situations in community and home. In education, children and teachers have enthusiastically helped our club build and install safe, cheerful, and useful playground equipment using used tires in rural schoolyards. In water and sanitation, our club just completed a global grant for potable water in 2 communities. With enormous volunteer support and Rotary International financing, miles of pipe were laid by hand, providing 3,000 people with clean water in their own homes. Now we are doing a follow-up grant, global grant, so that the families that do have potable water can use it to further improve their families' lives by installing 40 aquaponics systems that grow tilapia in a tank. The fish's wastewater gravity feeds into grow beds where plants clean the water for the fish, which is then pumped back into the fish tank. With this closed system, a Nicaraguan family can produce 50 pounds of fish and hundreds of pounds of vegetables every 6 months in their backyard. Our Rotary Club also just finished a global grant in dental health, to provide dental care and dental hygiene training in local area schools in partnership with the Nueva Vida Health Clinic, a project of the CDCA. The clinic was begun after Hurricane Mitch devastated Nicaragua 2 decades ago and has been in continuous operation for over 20 years, committed to maintaining the health services being provided in spite of the enormous loss of regular clinic funding due to COVID-19 cancellation of volunteer medical brigades. In spite of taking precautions, our clinic did shut for 1 month when all 3 of our doctors tested positive for COVID-19, and our health promoter with serious chronic illnesses and who was also a founding member of our Rotary Club got coronavirus and died. Since July, the clinic has been again providing services, even while on a shoestring budget, allowing time to disinfect rooms and change PPE, struggling to support our 150 patients with chronic illness, pregnant mothers, and teenage boys and girls. And just yesterday, the director of the clinic put out a special plea, which I don't know if you're interested or not, but let me share it. Nicaragua vaccinates for free, does children's vaccinations for free, and has added hepatitis B to that list of children's vaccinations. But our clinic staff are adults, and that vaccine hasn't been available here long enough to have included them when they were children. And so we are looking for $2,000 to get our clinic medical staff hepatitis B protection, because hepatitis B is in Nicaragua. Not only does our work in service out in our community continue in spite of the difficult pandemic, but we are developing projects that address changing needs identified by Nicaraguans in the communities where we work. Our job as Rotarians and as the CDCA has been to try to figure out how to best support these local efforts in the wake of the tremendous blow to Nicaragua's economy caused by the pandemic and now from the hurricanes. How can you as Rotarians help? Well, partner with us on another project. We still need your help. Our Rotary Community Corps has prioritized the enormous need for proper sewage disposal in the community of Nueva Vida, formed 20 years ago after Hurricane Mitch. In this neighborhood of 16,000 people now, families use pit latrines with an average of 5 people per latrine, and some homes have no latrine at all. Used wash water runs in the streets, creating a breeding ground for mosquitoes that carry malaria, dengue, Zika, and chikungunya. Although COVID-19 has dominated the news, far more people here die from mosquito-borne illnesses, and we know that Nueva Vida is at a critical public health point. The mayor's office and the city water department are in full support of this project, but have no funding with which to develop it. Step 1, therefore, is to fund the necessary assessment. That assessment's information can then be formed into a global grant proposal with needing partner clubs. So we have an immediate need for $18,500 to carry out this feasibility study, this assessment, to obtain the engineering, design, and specs for the needed lift station system. What about opening opportunities for young people with the disruption of the pandemic? Ciudad Sandino is one of the poorest urban areas in the country. The lack of opportunities and the level of poverty even before the pandemic make it difficult for young people to face family breakdown, social exclusion, and discrimination. Our club is working with the Ruben Dario Cultural Center, where 200 at-risk children, teens, and young adults receive free courses and workshops in dance, fine arts, and music to expand and improve the center so that students can develop their skills and invest time in their personal growth within a culture of peace. What about economic recovery from the pandemic and hurricane? As I mentioned earlier, agriculture forms the base of Nicaragua's economy, but climate change is a huge challenge. One main export is coffee, the mostly produced on small family farms. What can you in the U.S. do? You can help small farmers growing organic coffee in Nicaragua connect directly with those of us who love a good morning cup of joe. Farmer Shares is a new venture building on 20 years of successful partnership with one Nicaraguan organic coffee cooperative, now expanding to work with 5 co-ops, using a new business model to directly import, roast, and distribute coffee, shipping to monthly subscribers, returning its profits to the coffee cooperatives. A 3-year global grant will help establish this model through use of social media with the goal of expanding sales to include 2,000 beneficiaries in Nicaragua, and will also help mitigate the effects of climate change for small farmers by establishing nurseries to grow a resistant variety of coffee, renovating 1,600 acres. We will support direct connections among roasters, consumers, and farmers. Through this global grant of $64,000, cementing relationships and sustainability, doing what Rotary does best, opening opportunities. Rotary opens opportunities. When we support Nicaraguans in rebuilding their country, we open opportunities. When we bring Rotarians, teachers, students, and parents together, we open opportunities. When we bring sponsoring clubs, local communities, and municipal authorities together to solve the urgent problems of water and sanitation, we open opportunities. We open opportunities when we act together. We open opportunities when we are kind. We open opportunities when we are generous. Nicaraguans are resilient people, but they can't do it without strong partners. Will you partner with them and with us? Will you help us continue to open opportunities? Thank you. So I've put my email in the group chat, and if you will add your names and emails there so we can share that information. And these cards have the links to our Rotary Club website, and also to my day job, the CDCA, which you can donate through that way. And we'd love to have you continue to join us in our work. Thank you.